Alright, so for the next muscle, we should be looking at its basic anatomy. Alright, so the basic anatomy will basically help us later on when we are talking about pathologies that have to do with, or disease conditions that has to do with us mentioning this muscle. At least it will not be something new, So this is what is known as a Flexor Digitorum Superficialis. Alright, Flexor Digitorum Superficialis. So this one, right? So for the Flexor Digitorum Superficialis, just so you know, is a key muscle in the anterior compartment of the forearm. So it helps you to flex your fingers, especially at the middle joints, right? That's middle phalanges. So it's part of the superficial flexor group, plays a major role in gripping and also fine motor task. Alright, so anatomical snapshot is what? Origin. Where is the muscle originating from? Of course, from this place. What do we call it? This is the Humeroulnar head. Alright, the Humeroulnar head is the medial condyle epicondyle. This head is called the Humeroulnar head. Right, is the medial epicondyle of the humor, or the humerus, right, and the coronoid process of the ulna. Then the radial head, so the proximal half of the anterior border of the radius, right. So all of them, comes into what? It becomes tendons. So those tendons are inserted in the digit 2 to 5. All right, that digit 2 to 5 is a middle phalanges. All right, so innervation is the median nerve, blood supply, ulnar artery, radial artery, median artery. Okay, so function is primary action is flexes the proximal interphalangeal joint and the metacarpophalangeal joint of the fingers. Secondary action is in wrist flexion, all right, and all of that. So clinical relevance can be involved in carpal tunnel syndrome, right? Can be involved in squam neck deformities, and you can also test the strength of the muscles just to see if there's any issue in the hand and all of that. Okay, so that's it, and good luck.